Zambia is publicly revealing why talks with the United States over a multi-billion-dollar health package collapsed. Lusaka says Washington tried to tie health funding to access to critical minerals and demanded health data sharing that would violate Zambian privacy laws. Foreign Minister Mulambo Haimbe says the US offered $2 billion over 5 years for health programs. But he says proposed conditions on health data sharing were unacceptable and that the US linked the health deal to a separate agreement on critical minerals. A cause for further concern was how the two separate proposals were tied to one another, such that the conclusion of the critical minerals agreement is made conditional on the conclusion of the health MOU, he said. Zambia also rejected a draft mineral deal, citing a demand for preferential treatment for US companies. Lusaka insists that the two agreements be judged separately on their own merits. Outgoing US Ambassador Michael Gonzalez has accused Zambia of failing to engage before an April 30 deadline, a claim Zambia denies. Zambia is Africa's second largest copper producer. The mineral is in high demand for electronics, infrastructure, and renewable energy. While Zambia, Ghana, and Zimbabwe have turned down US deals under the Trump administration's global health strategy, about 20 other African nations have signed similar agreements. The US initiative is aimed at fighting HIV, malaria, and tuberculosis. Experts say countries that turn down US health funding may need to seek alternative sources. Zambia had previously received over $7 billion in US health assistance since 2000, helping fight HIV and malaria. Despite the deadlock, Foreign Minister Haimbe says he remains optimistic that brother cooperation between Zambia and the United States will continue. But for now, both sides are publicly trading blame, and the health funding gap remains. I am Otaria Benjamin, reporting with clarity on the issues that impact our continent. This is Media Room Africa.